Yeah, so thank you so much for having me. I'm also joining from Mainz in Germany, and I'm very happy to have the opportunity to talk a little bit about quality of life in children with chronic spontaneous urticaria. So now we heard from my colleagues what we actually treating, what we are dealing with, the visible symptoms like angioedema or the urticaria you can see on the body. But what we have not quite touched upon is what lies underneath the surface. So problems like skin pain, quality of life impairment, sleep disturbances, also the mental burden that these kids are suffering from. So I would like to share this picture because it nicely shows what urticaria affects. So, for example, it has a high impact on school performance. It also has a great impact on the family social life, and also, for example, what I added here, and I said before, also on sleep. And if you look at, and this is a quite old publication, but it still is valid until today. If you look at other diseases in children, and this is a quality of life questionnaires that was handed to the patient or to the parents of the patient, and they had to fill it out. They have to rate the quality of life in their children with different disease. And then you see here, for example, asthma or psoriasis, and then way up, all the way down there, you see urticaria. So you see that urticaria has a really, really, really high impact on quality of life compared to all these other diseases. And as Petra mentioned before, we do need to see the whole picture because it's mostly not only the chronic spontaneous urticaria, but also there are some other diseases that also impact the quality of life. And it's really important that the specialists also recognize the other comorbidities that are playing a part in this whole disease. And just if you look at all the comorbidities that are part of this chronic spontaneous urticaria, or the cloud, remember the cloud that I showed you from the beginning, like how many aspects of life this has an impact on, then it's not surprising that the child feels embarrassed by the skin symptoms, has the problems with his or her self-consciousness, avoids social situations, and does withdraw from relationships. And so then only this is a logic consequence that they do suffer from mental burdens, like, for example, social phobia or depression. And also, we did a nice research, and we looked at data from health insurances, because this is what we can get when we look at health insurance data from all over the world. And we just see your child and we looked at this population, where you could see that children at the beginning of age 5, for example, in this example, 5 years after they had their first diagnosis of urticaria, and how much at risk they are to develop mental problems like depression, like anxiety, like but also insomnia, or like troubles sleeping, for example. And we see that there's a really, really high risk. For example, here, all that is red means that they are at a higher risk than children who don't have the diseases. So this is really makes sheds light or makes it obvious that we have to look for these problems and to treat the disease as early as we can to avoid that children really develop such kind of comorbidities. And this is also, I don't want to bore you with data, really. I know most of the time you look at data and you say, what does it really tell me? But I'm here to explain to you what it does tell you. So this data, it was and also in publication they did, and I looked at data from all over the world, and they saw that depression is really high, has a really high, is a really often comorbidity in patients with, in children with chronic spontaneous urticaria, and also anxiety is really high, like 30% or almost 30% of children had anxiety disorder compared to control group. So this is really something we need to address and need to recognize. And also this is another population, and this they saw that almost 50% of the patients, of the children, had an additional psychiatric diagnosis. So, and anxiety again was the most prevalent ones among this. But let's look at the definition of anxiety, because if you just Google anxiety, and you can nowadays you can do it quite easily, just ask ChatGPT, what is anxiety? And I actually did it, and what ChatGPT told me is this clinical definition that anxiety disorders involve excessive fear and behavioral disturbances. It is accompanied by persistent worry, physical symptoms, avoidance behaviors, and impairment in social, occupational, or daily functioning. And now, if you think about urticaria, then it totally makes sense that your children or your child suffers from anxiety, because we do have physical symptoms, we do have avoidance behavior, and also impairment in the daily life. So this makes total sense that they develop anxiety. And I created this little image for you because I feel like this is a vicious cycle. You know, for example, you have a flare, your child has a flare of urticaria, and we call it disease exacerbation. And because of this urticaria, either because of skin pain or because of itch, they have troubles sleeping at night. These troubles lead to the fact that they now have daytime impairment, because if you can't rest during the night and then you feel so tired during the day that you can't really go to school, you don't have the necessary concentration, and because of that, and you feel left behind, you cannot follow what the teacher says, and because of that, you develop mental or physical burden. And you see, it all kind of plays together. So what are the symptoms that really impact your child? And I think this is really necessary to discuss, because if you know the symptoms, you can find a way maybe to avoid it. So, for example, we didn't want to talk about inducible urticaria, so urticarias that can be stimulated by triggers. But sometimes when you have a chronic spontaneous urticaria, like Petra said, you can also have inducible urticaria on top of it. So, for example, if your child has a chronic spontaneous urticaria and also but cold urticaria, so your child gets triggered by, for example, when they go swimming in the school, or they cannot have ice cream because ice cream will trigger the symptoms, or for example, during vacation, they cannot jump into the ocean because the water is too cold for them. And for another example, exercise-inducible urticaria, like Petra said, if you're doing exercise or in the school, for example, then your child cannot take part in the school activities. So this is a really we need to discuss it. So, for example, if your child needs antihistamines, I would recommend in this case that you take the antihistamines right before you plan, for example, to like do sports, or your child is affected by cold or heat. If, like, for example, before they go swimming, sometimes this can help. But of course, not in all cases. In severe cases, we need to try to avoid those specific situations. The unpredictable nature is also something that is really bothers the child. So if it just comes without them knowing, and they're doing something fun, doing their fun time, or doing school, and they just sit there, and all of a sudden it starts. This is also the nature of these outbreaks, makes it really hard for them to cope with it. Then also, when we talk, I also mentioned the sleep. Sometimes the first generation antihistamines, so there are first and second generation antihistamines, and normally we treat with the second generation antihistamine. This is what Larissa said before. But sometimes when, for example, when you want to have the benefit of the first generation antihistamines, and there's really only this one benefit, that it makes them a little bit tired, and so you can use it to your benefit if you give it to them in the evening. But you have to be careful. If you're using first generation antihistamines for too long, then it can affect your child's sleep very, very much over. So this should only be for a short period of time. And also, you have to check if they feel tired the next day, because some children, if you give them the first generation antihistamine in the evening, then they feel tired the next day still, and this is something we want to really avoid. Also, corticosteroids, if you give it to them in the evening, like cortisone, then this also can affect your child's sleep. So you really should try it. If your child needs cortisone as a rescue medication, like described before, don't give it to them in the evening. So during daytime, second generation antihistamines, because they don't make your child tired, are the way to go. Then we talked a little bit about diet. Yes, I agree. There are some factors that can exacerbate the urticaria. But we do not recommend, if you don't find like a trigger, really something that when you say, for example, every time he eats tomatoes or every time he eats candy, and really this urticaria is going crazy. If you do not find such a trigger, please do not put your child on a diet, because it will mean that the quality of life will get more and more and more impaired for the children. So the child doesn't want to feel left out. He wants to eat candy just like any other child does too. What parents are often concerned is that it is some kind of allergy or so, and this is something we really need to get away from. It's not an allergy. Also, in understanding the cause. Parents always want to understand where is it coming from, and we do too want to understand where is this coming from, but we also have to accept the fact that we are not quite there yet. We do not know where urticaria comes from, so we just have to treat the symptoms and wait that the urticaria resolves on its own. This is also a publication from Petra Staubach, and she just once more showed that those patients who also had like anxiety or depression, those children, were more likely to have impaired quality of life. And this is also very, very obvious. That makes total sense. And also, I want to not leave out the parents or the caregivers, that their social life, their quality of life is also impaired, because you worry about your child, obviously. And also, if the child sleeps in the same bed, if it's a really small child, for example, then your night sleep gets affected too. Or the child comes to your bed and says, "Mom or Dad, I am itching," then of course you wake up and your night sleep is troubled as well. So what I do recommend is don't, if it's a small child, please avoid having the child in the same bed. You can have it in the same room. This might be even beneficial, but avoid co-sleeping with the child. So what else can we do? You should know about the triggers. So for example, you should write a diary. You should write a diary with your child together and see maybe there are some triggers that we can actually avoid. Then sometimes addressing psychiatric comorbidities, like even with an expert, can help to improve the quality of life. Some things you can discuss with your child, and you can help with you can help your child, but some things like especially anxiety and depression are something where you should look for an expert to talk to. Then also improving sleep quality can help to improve the quality of life, as I already mentioned before. And sometimes first generation antihistamines, and only in this case really, could help maybe to get a restful night, because it makes the child a little bit tired. Then, as I mentioned before, avoid strict diets. And education-wise, you should also include everybody who is like in contact with your child. For example, teachers or friends, they should know about the disease, explain them about the disease, so that they know what to do if something is like if a disease exacerbation is actually happening, and they do not feel left out. Sometimes even talking to your children's friends, explaining them disease, can help, so that the children don't bully them in school. So it's really like this image shows we have to see the whole picture. We cannot just see one little piece of a puzzle and know how everything is. We have to see the whole picture, because just seeing just one puzzle piece doesn't really explain what's like. Remember the ice I showed you at the beginning. It doesn't explain what lies underneath the surface, and we have to treat every aspect of this disease so that we both, us and the patient, can be happy. Some good news that have not been mentioned, or maybe in one little part have been managed before, is have been mentioned before, is that approximately 40% of children lose the symptoms if they when they're becoming older. And also another Turkish study showed also that within 5 years, 50% of the children can lose the urticaria, which I think what Petra said at the beginning, it's not a disease for a lifetime. This is really good news. And also what Larissa said, we have therapy. We have good therapy, and also some good news. The second generation antihistamines usually lead to symptom control in children. So if some of them like if they have only one dose, but even when they have fourfold dosage, it can lead to symptom control, and in most part of the children. And so omalizumab, for example, is only needed in a small percentage of children. So I now want to finish my talk, and I'm looking forward to your questions, to the discussion. And I want to quote Marcus Maurer here. He's always said, treat the disease until it's gone. And yes, thank you so much.
Thank you, Caroline. Really interesting talk.